Hello, my name is Teresa Gennaro, and I am a current fourth-year pharmacy student at Xavier University College of Pharmacy. The title of this presentation is The Effects of Exposure Factors on Hypertension and Hyperlipidemia Prevalence and Control in Patients with Uncontrolled Diabetes. In 2019, the worldwide prevalence of diabetes in adults was about 462 million and is expected to increase to 700 million by year 2045. Only about 50% of patients with type 2 diabetes are considered to have their blood sugar properly controlled with an A1C under 7%. As the prevalence of diabetes continues to increase, it is estimated that more than 1 in 4 Americans have multiple chronic conditions, including diabetes, hyperlipidemia, and hypertension. The purpose of this research is to examine the association of exposure factors, gender, race, employment status, and smoking status, and their effects on hypertension and hyperlipidemia prevalence and control in patients with uncontrolled diabetes who declined pharmacist-led diabetes management services. The objectives include identifying patients with uncontrolled diabetes who also have additional chronic disease states such as hypertension and/or hyperlipidemia that declined pharmacist-led diabetes management services, to determine the level of control of each additional condition, and to examine the association of exposure factors on hypertension and hyperlipidemia in patients with uncontrolled diabetes. This single-center retrospective cohort study examined patients with uncontrolled diabetes who stated during a phone call intervention that they were uninterested in the free-of-cost diabetes management service offered by the pharmacy team at the Family Medicine Clinic at East Jefferson General Hospital. Inclusion criteria included patients with uncontrolled diabetes defined as an A1C of greater than or equal to 9% who declined these services when contacted via telephone during a 32-month time span from September of 2016 to April of 2019. Patients were excluded from the study if they did not answer the phone or if they had agreed to participate in the pharmacist-led diabetes management service. Data collection consisted of patient-specific characteristics, including patient's age, race, gender, smoking status, employment status, A1C at time of call, BMI, number of chronic conditions, number of clinic visits in the last 3 years, and current dosage form of diabetes medications, oral versus injectable. Bivariate analysis of exposure factors, gender, race, employment status, and smoking status in hypertension prevalence, hyperlipidemia prevalence, prevalence of controlled hypertension, and prevalence of controlled hyperlipidemia of the study participants were performed based on Fisher's exact test. Baseline characteristics for the study population consisted of 91 patients, 46 of which were males and 45 were females. Racial data was obtained for 90 patients. 63.3% of the study population were white, 28.9% were African Americans, and the remaining 7.8% were classified as other, which included Hispanics, Asians, and other races. Employment status information was able to be obtained for 59 of 91 patients, with 54% identifying as employed, 27% as not employed, and 19% as retired. 90.1% of patients had a charted diagnosis of hypertension, and 86.8% had a diagnosis of hyperlipidemia. Prevalence of hypertension and hyperlipidemia control were 63.41% and 52.86% respectively. There were no significant gender, race, smoking status differences in hypertension prevalence, hyperlipidemia prevalence, prevalence of controlled hypertension, and prevalence of controlled hyperlipidemia of study participants. Similarly, there were no significant differences in hypertension prevalence, hyperlipidemia prevalence, and prevalence of controlled hypertension. However, employment status made a significant difference in prevalence of controlled hyperlipidemia with a p-value of 0.0251. In this study, the only exposure factor that was statistically significant was employment status on controlled hyperlipidemia. Of the patients who were employed, 68% had controlled hyperlipidemia. Although not clinically significant, former smokers had a greater percentage of patients with controlled hypertension and hyperlipidemia compared to current smokers and non-smokers. It is important to note that the findings of this study should be interpreted cautiously due to the study's limitations, specifically regarding patients' profiles lacking employment status history. Further research is warranted in larger populations regarding the effects of exposure factors on patients with uncontrolled diabetes who decline management services. Thank you.